So we are now going to, I am going to introduce the next two speakers, Allison Glasser and Raymond Niora, who will be presenting both of them together. Both of them work with the Truth Initiative. And Allison is a senior project manager with the Schroeder Institute for Tobacco Research and Policy Studies at Truth Initiative. She manages various projects related to tobacco regulatory science, including conducting evidence reviews and preparing knowledge synthesis papers and facilitating communication among various scientists. And I'll introduce Raymond, or are you going to have two separate presentations?
Go ahead and introduce Ray, that'd be great.
Okay, very good. So Ray is the Director of Science and Director of Training at the Schroeder Institute, and he's also an adjunct professor at Johns Hopkins Bloomberg School of Public Health and at the Lombardi Comprehensive Cancer Center at George University Medical Center. And he's interested in behavioral substrates of tobacco dependence and behavioral and pharmacological treatments for cessation. Thank you.
Thank you very much for that introduction. So yes, we will be covering a systematic review on the literature on ENDS that my colleagues and I at the Schroeder Institute have been working on over the past couple of years, with a focus particularly on the studies examining the health effects of ENDS use, or the human health effects of ENDS use, rather. Here quickly are our disclosures in case the committee would like to review. So the role of the Schroeder Institute is to be a resource for tobacco regulatory science. And part of that is staying up to date on what is known about emerging and new tobacco products. So given the dramatically changing product landscape as well as policy landscape, we decided to undergo a ongoing and comprehensive systematic review of the literature on ENDS to be able to be that resource and continue to inform not only research but also policy and regulatory activities. So data for this presentation were pulled from our ENDS review that was recently, an overview of which was recently published in the American Journal of Preventive Medicine. We use the National Library of Medicine's PubMed database to search for, using these keywords here on the slide, published literature through May 31st, 2016. Now we did conduct an update on February 1st of this year, which yielded an additional 249 studies that we deemed to be relevant to our review. So those have not yet been synthesized, but we plan to systematically review those for other more focused papers that we have underway. But we will highlight some of the newer studies here. In terms of eligibility, studies were excluded if they were not published in English, if the content was not relevant to ENDS, and if they did not contain original data. Otherwise, they were included in our review. So our search in May of 2016 identified roughly 1,600 articles. About half of those were screened out through the abstract and title review phase of the review. 687 articles were included after full text review. And you can see here the different content areas into which we sorted the included studies. One study could be relevant to more than one content area. But they were most relevant to patterns of use, followed by consumer perceptions, and then health effects, which we will be covering here. This graph also shows you the number of studies published per year since 2010, and these are only studies included in our review. Keeping in mind that for 2016, this only includes articles published between January and May, so the total number in 2016 is likely much higher than this. So narrowing it down to those examining the health effects of ENDS, we included 129 articles, the majority of which were human subjects, included human subjects. Our updated search actually identified an additional 57 articles relevant to health effects that we will include in the future. Studies addressed a variety of outcome measures, including physiologic and cognitive effects, adverse events, exposure to secondhand vapor, as well as the cytotoxicity of ENDS. Here's a table from our published article that covers all of the biomarkers measured in our included studies. I'm not going to go into detail here about those, but later in the presentation, Ray will be discussing going more in depth into some studies that cover some of the biomarkers that are listed here. So what were some of the conclusions that we came up with? Overall, studies of vaping indicate no or minimal impact on physiologic biomarkers and some possible acute positive impact on cognition and mood regulation. There were limited studies examining cardiovascular measures, but there are a couple of longitudinal studies that show among smokers who switched to ENDS, over time they saw a reduction in heart rate and blood pressure. Lung function studies either found no impact at all, or in the case of smokers who switched to ENDS, they found an improvement in lung function as a result of ENDS use over time. And then there were a couple of lab-based studies looking at cognition that they found that following ENDS use, participants saw an improvement in memory and mood. In terms of toxicant exposure, we know that ENDS liquids and aerosol do contain measurable amounts of nicotine and other toxic constituents, but at significantly lower levels than what are found in tobacco smoke. For human exposure studies, human biomarkers of exposure to toxins have been shown to be significantly reduced in current and former cigarette smokers using e-cigarettes. And we found that that's even true for the later generation devices or the larger tank systems as well. So this is where I'm actually going to turn it over to Ray. He's going to discuss some of these studies more in depth, and as well as go through some issues with dual use and then some challenges we faced with our review.